Hi everyone, so in this video we are going to talk about scar revisions. So we have two patients today that you are going to see in this video. One of them unfortunately was a victim of a criminal act and she has a scar across her face that we're going to try to improve. It's a little bit indented and the light catches it, so we're going to try to make it perfectly flat for her so that when she uses cover-up it's not noticeable. The other patient had a lesion on her thigh as a child that was partially removed, not completely removed, and the scar doesn't look very nice and she still wants the rest of the lesion removed. So for her, we are going to be removing the entire lesion. It is in a sensitive area and that it is on stretch, so we have to use very strong sutures to take the tension off of the scar in order to allow it to heal thin and flat. We are going to use resorbable sutures, nothing really to remove in the office, everything is going to dissolve on its own. And we're going to place steri strips, which are white long stickers that are going to give that scar a lot of strength while it's in the healing process. For the patient with the face scar, we're essentially going to just remove that scar and sew it back together. There's a lot of times when there's tension on a scar or if it's pulling that we would create zigzags inside of the scar, but in this patient I decided that probably creating a zigzag scar on her face would not be emotionally acceptable to her. I just wanted to sort of improve upon what she had and not create any extra things for her to think about. So basically just remove that scar and put it back together. Now both of these patients, scar therapy afterwards is going to be extremely important, and what I have them start on is a silicone gel 2 weeks after the procedure. They're going to use that morning and night, and then in a month after the procedure they're going to continue to use that silicone gel in the morning, and I'm going to have them start using silicone sheets at night. The silicone gel and sheets, they help the scar sort of not become thick, not become so red and angry, and really speed up that healing process. The gel comes in with SPF and without SPF. If it's on the face, obviously we're going to use the one with SPF, but on the thigh, probably the one without. The sheeting as well is very strong. That's why we don't start it until after a month when the scar has some strength. If you start it before a month, it will actually make the wound fall apart. So we only use that one 12 hours on, 12 hours off. Some people prefer to wear it in the morning and then just put the gel on at night, and some people prefer the gel in the morning and to wear the sheeting at night. So either one is fine, and it really is patient preference. We do continue to watch these scars very carefully. Other things we can do to help them heal their best is steroid injections in case they do get thicker, or lasers afterwards in case they are pigmented and we need to address that. So if you have a scar that you're not comfortable with and that you'd like to have removed, make sure to come in and we'll take a look with our 15 devices and surgical skills. I'm sure we can help you out.